Okay. Alright. So, random instructional video here. This is enoxaparin sodium. Anyway. That's what the box looks like. Opens up. Every box comes with a handy dandy little instruction booklet in case if you ever have any questions or concerns that you're not doing it right. Or just watch my video again. I've already taken 2 from this box, so there's 8 left. 1 for tonight. Easily separates. Set that off to the side. The instructions say it's best to be seated. Personally, I've discovered that I prefer to stand. Okay, because I'm more distracted, so that the initial stick doesn't suck as much, but that's my preference anyway. This one is Winthrop. It's the generic of Lovenox, because the name brand of the prescription Lovenox is outside my pay range. And anybody else is probably too, because, you know, that's ethical. But most shots, whenever you think of them, you think, get the air bubble out. This isn't going into a vein, so you don't have to worry about that. Actually, you want the air bubble to tap it so that it's at the top, so that whenever you get to the very end of putting the medication into your body, it kind of helps push that last little bit out into it, and so that whenever you withdraw the needle, it doesn't have the medication come back up through your skin as much, because that can increase the chances of bruising. I think the #1 most common side effect of Lovenox, or enoxaparin sodium, is bruising. It's one of those weighing the pros and cons. I'll take bruising over dying. This seems like a good payoff to me. My big fat belly. This is what happens whenever you get kind of further along and babies start kicking more. I was halfway through doing the injection and the baby kicked really hard right there, and I just nicked the muscle. And combined with the fact that I went a little closer to the shot that I had done previously in that area, it bruised. This is the healing of the bruise. It's a lot better now than it was. There's still like a hard spot because it bruised in the muscle, not uterine muscle. Didn't go that deep. It's not that big of a needle. But it just nicked some of the muscle tissue of my abdomen, and it bruised. That's what they do. That's how you know it's working though. Not really, but every 12 hours, and usually mornings, nights, sometimes I'll swap it up and be like, oh, well, I'm going to go up here today, so I'm going to do that. I'm not flexible enough to do like back here, but Erin's able to help me with that stuff sometimes. A good thing to note is these stretch marks are not from this pregnancy, they're from the previous pregnancies. They're just more prominent again because of hormones and stuff. But any like a spot to as a better example than stretch marks even, like if you've had your appendix taken out, don't inject into that area because it won't absorb properly, and scar tissue hurts a lot more to to have to shove a needle through. So stretch marks, they're not as sensitive, and they're definitely not as deep as a surgical scar, but it hurts a little more. So if at all possible, just avoid stretch mark areas, especially new stretch marks. New stretch marks, the skin's already inflamed, it will bruise, for sure. New stretch marks will bruise. I learned that previous pregnancy. Anyway, these, if I can get close enough, little dots are some of the previous injection sites. That's your typical bruising instead of fat. And it's not an every time deal, but sometimes they're nothing to worry about. It's an anticoagulant. It also will anticoagulate the blood very local to where it's injected in at. You don't want to like grab real deep. You want to just like put your hand there and squeeze the skin, because if you grab like that, you're going to grab some of the muscle, and that's how you're going to inject in the muscle. So that, just kind of squeeze the skin, and you keep it pinched. And sometimes I'll go and start in a spot that maybe that spot hurts, and I will relocate. Always make sure that you're kind of in a well-lit area. Like, can't tell as well on the video, but it's pretty bright in here. Because you don't want to go for an area that has like a vein kind of close to the surface, because same thing, the bruising, it wouldn't be like this big of a bruise, but it would be noticeable. And it would make it so that you can't inject where that bruise is also until the bruise heals. And not to mention nicking of veins. It's uncomfortable. It stings. So, yeah. I am comfortable with doing this standing anymore because I've done it so much. Not just this pregnancy, but in the past as well. You definitely have to find your comfort zone with it. And sitting, standing, whatever you prefer. I've got it all the way in now, and this is where that air bubble comes in handy too, because it kind of makes it so that it's not a sudden push in, because it's got to compress that air bubble a little bit. Take your time. It's kind of one of those overly ignored things about it is take your time. Don't push it in there fast. It'll sting. It's supposed to sting. It's all the way in. I waited about a second or two. And withdraw, and you pull it out the same way that it went in. And a little bit of the medicine came out. Not as much as if I'd pushed that air bubble out. And a little tiny speck of blood. It's nothing to be concerned about. It's nothing, I don't even think it's showing up on the thing. Even if it stings, and sometimes when stuff hurts, you have that instinct to rub it, don't. It'll press all those capillaries and stuff in that area, and it'll leave a bruise. So, little red mark, completely normal. Doesn't hurt, it stings for a little bit after, but not terribly. On a scale of 1 to 10, it wouldn't even register as a 1. So, if you have a tattoo, you've already done more injections than you would for one pregnancy. And to get the sheath to go down, because spent needle, sheath hasn't been deployed yet. I usually, the little thing that it comes in, because sometimes it sprays sometimes more stuff comes out, so I usually just kind of hold this under it, press that down, and pop. And that is the little protective sheath. And that is that. The red sharps containers that you can buy at stores, especially if they're the type that have the hole or the slot or the little slide or anything on the top, are not made for these size syringes. They're made more for hypodermic needles, like what a person would use for insulin. Not for these. These are way too big. So you can modify one of those containers, but it's easier just to, whenever you're done with it, put it back in this and put it into one of the empty boxes and dispose of it however your doctor or pharmacist would advise you from there. And I'll do it again in 12 hours. That's about that. By the way, me saying, oh, it doesn't sting, this and that, Aaron's probably in the other room. I can hear him folding laundry in there, and he's like, yeah, she's bullshitting. She complains a lot. At least once a week, she's over here. What did you? Because it sucks. It does. Because, I mean, whenever you're doing a shot twice a day for... We did the math at one point, but it's late right now, so I can't math, but a whole bunch of days. Basically 35 weeks, because most people find out around 5 or 6 weeks that they're pregnant. Pregnancies are supposed to be about 40 weeks long. That's a lot of shots. I am 26 weeks tomorrow, I think. Very happy I have love handles. It gives me more spots to be able to do my shots. But yeah, I get sick of them. It sucks. But I'd rather have to do another shot than to worry about, dying or losing my baby. So it's worth it. That's right. We just kicked really hard. So, but another view of the box here. Enoxaparin sodium. And I'll read this off as my final thoughts here. It's the print off that came on the box from the pharmacy. Check with your doctor if you plan to become pregnant while using this medicine. This is the only approved anticoagulant for pregnancy. Everything else either hasn't had enough studies done or has proven to cause major defects. Warfarin is very bad. If you are on warfarin and want to become pregnant, you need to tell your doctor that. And you need to make sure that you are not on warfarin when you get pregnant, because it's the first, I think, 9 weeks of development is whenever it causes the most severe major birth defects. It is very dangerous to become pregnant while taking. And I cannot stress that enough. Enoxaparin sodium, Lovenox is the name brand, is approved for pregnancy. If you're on it though, you follow the advice, still talk to your doctor about it. They'll probably advise for you to wait. That's up to you. You can always stress to your doctor that you don't want to. And most they can say is, well, make sure that you take your prenatals and don't miss a shot. And to inform them as soon as you suspect that you are pregnant. Contact your doctor if you develop unusual or persistent bruising or bleeding. What they mean by that is like by the bleeding, it would be like some bleeding in pregnancy is normal, like not there, but like nosebleeds, not uncommon. But if it's one that like you just can't get it to stop, yeah, get seen. Hemorrhoids, if they just don't seem to stop, be seen. Bruising near the shot areas, normal. They're probably going to look at you like you've lost your mind and tell you, well, you could try an ice pack next time. And you're going to get some eye rolls, especially if you go in the ER. You're going to get a whole lot of sitting in triage and then not doing anything. Or, yeah, but if you'll be at an increased risk of some minor bruising anyways. Like, everybody gets the shin bruises that's like, I don't know where, it just showed up one day. I didn't hit anything. It's normal. Everybody gets those. It's like you just forget or something. Like you hit something, you're like, I'm gonna hurt. And whatever. But this is more like, okay, you're getting a lot of those all at once, where they're like on your thighs, on your shins, maybe on your calf, arms, or like if someone grabs your hand or wrist or something, not like forcefully, but just like, oh my God, guess what? And then like the next day you're like, oh crap, I have a bruise there. Definitely speak up about that, because maybe you need some blood work done to make sure that it's not messing up platelets and stuff too much. That's also important. I'm not making this as much informative as I hoped to, because I was hoping it was going to be informative, like, hey, don't be scared. I really don't think I'm sealing that deal that well. It's uncommon. It's very uncommon. I should stress that. It's very uncommon, especially because the dosage you take of this will be based off your weight. But if something is going on that will make you have these uncommon things going on, there's something else going on too that needs to be addressed. And it's better to know than to not know. So that it can be addressed, it can be taken care of, and you can live a healthy life. And, sorry, we went out to eat and I have heart really bad, so I keep burping. Do not take aspirin or other medicines, prescription or non-prescription, without checking with your doctor first. Also check with your pharmacist, because doctors tend to overlook stuff a lot. Like, a lot of people don't know, Prednisone, the steroid, increases your risks of having blood clots. I didn't know that. But, yeah. Aspirin, big no-no. Ibuprofen as well. Naproxen. Those are the three big ones. You don't really have to restrict your diet on this. Like warfarin, you do. You have to. It's a vitamin. Warfarin is a vitamin K antagonist, so you have to limit what you eat and stuff like that. And you can't drink green tea whenever you take warfarin, which is dumb. But it actually is because green tea really does flush toxins out of your body, and warfarin is rat poison. I don't like it. It's a necessary evil though, because there's not enough research. But, yeah, this stuff, if it were more readily available and more affordable, I would much rather do shots every day for the rest of my life than to have to take warfarin. The risks are so much lower, and it's easier, but very few side effects. Swelling, like edema type swelling, is one of the common ones. That one's fairly easy to manage, and if you have something going on, be it clotting disorder or recent thrombic event that warrants the use of it, you're probably already taking steps to minimize any sort of edema or swelling anyways, be it compression stockings or regularly propping your feet up. So those side effects are pretty easy. Pregnancy wise, like my hands are a little puffy today. That's more pregnancy related than medicine related. Yeah. I don't want to be like super misinforming you. I mean, you can do a lot of this information off the internet. Blah, 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 blah. Oh, one I almost did leave out. Spinal and like spinal tap and epidural hematomas. That is something to absolutely bring up if you are pregnant or planning to become pregnant, because you will be at an increased risk of developing a spinal hematoma because of the increased bruising risks. That's where it gets scary. But if you have a clotting disorder or a recent thrombic event that warrants taking anticoagulants, when you deliver, if you're not on this, you'll be on heparin. And this is much like heparin. So regardless, those precautions will have to be taken, and you just kind of have to weigh the pros and cons of your personal pain management options and go over a risk assessment with your doctor on that. Personally, I have fast deliveries anyway, and I've had to have natural deliveries just because of that before, where they're like, oh, it's too late. What do you mean it's too late? You're right there, I'm right here, let's do this. And they said that. So I had natural deliveries, and honestly it wasn't that bad because I was able to pee sooner after and had more control of things back, like walking. But that's really a very personal decision for anyone to make. But it is definitely worth discussion. Because spinal hematomas can cause very permanent damage. But I want to make sure that going over, make sure I pretty well went over all the major stuff, side effects wise. Oh yeah. Oh crap, that reminds me, I gotta get that test. Kidney function stuff. I really should have looked at this before hitting record, but here we are. Warnings and precautions. Increased risk of hemorrhage, bleeding, percutaneous coronary revascularization procedures. I don't know what any of that means. History of heparin-induced okay, thrombocytopenia. I'm not saying that correctly, and I know it. One risk that they will monitor closely with your blood work is your platelet count, because it can cause your platelet count to drop, which would make it so that your blood can't clot at all. That kind of goes hand in hand with the whole bleeding risks thing. There are several pages to this because blood's important. You know, it's the oil of our bodies. You figured they'd just put the whole, hey, this could happen right on the front, so we don't have to put through all this. They probably did. If you're vegan, I don't recommend it. This is not vegan friendly. That made me like it even more. I know that may make me a jerk, but you know. Anyway, yeah, I did. I pretty well went over all the side effects and stuff for the most part. Big risks, covered what it's like to get a shot. If I've left anything out, let me know, and I will try to fill the remainder of that in. And I hope that you feel well informed, or at least somewhat entertained, and like my shirt. So. Phone stuff.